So the next presenter is Dr. Vishal Prakash, Nandeshwar. Free paper number 21, Intraocular Pressure and Central Corneal Thickness Relationship in Industrial Workers in Rourkela, Odisha.
Good morning, everyone. My topic is the intraocular pressure and central corneal thickness relationship in industrial workers, Rourkela, in Odisha. Introduction. The eye is a delicate and complex organ susceptible to various occupational hazards, particularly in industrial settings. And industrial workers are exposed to numerous risk factors that can affect their ocular health, including chemical splashes, dust, and ultraviolet radiations. Intraocular pressure and central corneal thickness are two crucial parameters that play a significant role in maintaining the structural integrity and function of the eye. Research has shown that alteration in IOP and central corneal thickness can be indicative of various ocular and systemic diseases. Elevated IOP is a primary risk factor for glaucoma, while abnormal CCT values can influence IOP measurements and glaucoma diagnosis. The relationship between IOP and CCT has been explored in various populations, but data on industrial workers, particularly in Eastern India, is limited, and that thus our study wants to emphasize on the IOP and CCT relationship in them. Aim and objective. This study has been undertaken to determine the relationship between central corneal thickness and intraocular pressure in industrial workers, Rourkela. My study design was population-based cross-sectional study. 200 eyes of 100 patients were evaluated. Industrial workers from Rourkela visiting to IOPD of Ispat General Hospital, Rourkela. Study center was Department of Ophthalmology, Ispat General Hospital. Study period was 6 months. Inclusion criteria: all industrial workers who visited IOPD of Ispat General Hospital who given consent. Exclusion criteria: previous intraocular surgery, eye trauma, intraocular inflammation or tumor, significant ocular media opacities, dense cataract, corneal pathology. Those who have not given consent were excluded. Methodology: a population-based cross-section study was carried out on industrial workers from Rourkela who visited IOPD of Ispat General Hospital. After obtaining written informed consent, all participants underwent detailed evaluation including medical and ocular history and examination. The central corneal thickness was determined with ultrasound pachymeter and intraocular pressure by the Goldman applanation tonometry. All measurement of IOP and CCT were taken between 10 a.m. to 12:30 p.m. to control for diurnal variation. The measurement of both CCT and IOP were carried out by a single examiner to minimize inter-observer error. Data was analyzed using Spaces software, and p-value of less than 0.5 was considered significant. These are the results. Age distribution: 47 to 56 years was the age range. 51.5 is the average age. Gender distribution: females were more in my studies. 58 females, male 42. Results: these are the relation between the IOP and CCT with 0.002 significant p-value. A total of 200 eyes of 100 eligible participants were analyzed in this study. Multiple regression analysis shows significant positive correlation between CCT and IOP in this study. P-value of 0.002. The linear regression formula for this study was IOP is equal to 7.87 plus 0.016 CCT in mmHg. This indicates that a rise of CCT in 10 micron leads to an increase in IOP of about 0.16 mmHg. Discussion: previous research has shown conflicting results on the connection between IOP and CCT. Nonetheless, our result aligned with the research carried out by Alberta et al., where they showed positive association between IOP and CCT of the right eye. Correlation coefficient and the left eye. Similarly, Irgat and Elrium demonstrated the noteworthy and statistically significant positive correlation between IOP and CCT. Alcordi found moderate correlation between IOP and CCT, similar to our study. In a survey by Nijabet et al., there was also direct relationship between CCT and IOP with a significant value. Additionally, this indicates that rise in CCT of 10 micron leads to an increase in IOP of about 0.16 mmHg with a usual range of 10 to 21 mmHg. In our study, IOP was within the normal range, although there was a variation in IOP with the central corneal thickness of patients. Like earlier research, our study did not find statistically significant difference between IOP of the two eyes. Key-Metal found that non-glaucomatous patients had comparatively less frequent IOP asymmetry between bilateral eyes. This conclusion: central corneal thickness could result in systematic error in the measurement of IOP by applanation tonometry in study population. The CCT should therefore be considered in the management of glaucoma, especially in the industrial workers. These are my references. Thank you.
So what any difference? You told it was more significant correlation in males and females. Was there any difference?
No, ma'am. I have not compared female and male. In study population, females were more in my studies.
Okay, so you didn't compare
I
that.
didn't compare.
Okay. Okay, nice presentation.
Thank you.